Pregnant women can be uniquely vulnerable to many diseases or environmental hazards, but there's a way to make sure that you're well informed. It's as simple as making a quick phone call, a free phone call. Right on the other line, there's help. Joining me now is Uconn's genetic counselor, Sharon Lavigne. Sharon, thanks for joining me.
Thanks for having me.
Thank you so much.
Nice.
A delayed handshake. Now let's talk a little bit about your role. You're the coordinator for the Connecticut Pregnancy Risk Line. Explain what you do there.
What we do there is we take calls from pregnant women or their providers that have questions about exposures in pregnancy to learn a little bit more about what the real risks are for the baby.
So let's just bounce a couple of questions back and forth.
Sure.
I would say probably a common question you would get is about medicine. Maybe if you have to take medicine and you're pregnant, and people might wonder if a pregnant woman takes certain medicine, does it affect her baby?
Sure. Many women have underlying medical conditions for which they need to take medication, pregnant or not, and the benefits in many cases outweigh any of the risks for the baby. So typically we're giving reassuring information for the patient to say that yes, you can continue to take your antidepressants, to take your asthma meds, to take your medications for your diabetes, and in fact it's beneficial to do so.
Even when you're breastfeeding? Can you continue?
Many times in breastfeeding as well.
Okay, okay. And what are some other questions that you get as far as, I would say, maybe drinking or environmental hazards? What do you think?
Typically this time of year, the kind of call we get is a patient who perhaps was at a holiday party and now has recently found out that she's pregnant and is concerned about her drinking that she had during the party.
Okay, so and what would you tell them basically?
No alcohol is best, but typically the kind of intake that they might have very early stages of pregnancy is probably not going to put them at a significant increased risk.
Let's say someone is at work and they're exposed to some chemicals by accident. What's something that you would tell them to kind of put them at ease or to make them be aware of a possible risk there?
Well, we have a unique occupational, environmental, reproductive hazards clinic. So we take calls from women concerned about work site exposures, and we take into consideration sort of, are they wearing gloves, are they wearing a mask or a respirator, how often are they in contact with the exposure that they're concerned about, what are some of the limitations to what the knowledge is about those exposures, and how can they modify their environment to be safer.
I'm sure you would like our viewers out there, pregnant women, to know no question is a dumb question.
Absolutely
it's
not.
best to just call and put your mind at ease, right?
99.9% of the time we're really giving people reassuring information about what their concerns are. They imagine it to be worse than what it actually is.
Let's talk about some misconceptions, perhaps something that people always think it's one way and you're thinking, no, 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 let me set the record straight.
Probably one of the bigger misconceptions is a patient who needs, let's say, to treat their depression and their anxiety in pregnancy. Old school, we used to think that pregnancy made everything well and you didn't need to treat those conditions. So the misconception is that you really do need to stay on your medications to stay well, so you can be well for your pregnancy.
Mental health is very important.
Absolutely.
And quick question, I know we don't have that much time, but can the medicines or chemicals that my partner is exposed to affect our getting pregnant or affect the baby? That's another common question.
More often than not, they may impact a fertility issue than actually cause an increased risk for birth defects.
Okay, and again, it's a quick phone call away.
Right.
And I'm going to give everybody that number because I'm sure some people are wondering, so get that pen and paper ready. Thank you so much, Sharon.
Thank you for having
and
me.
let me, one more time, let me give you the information on the Pregnancy Exposure Info Service. You can call 1-800-325-5391.